Good afternoon, Madam Chair, members of the board. It's 2:00 p.m. and today is Tuesday, April 21st. My name is Brian Zumwalt. I'm the director of the county's Office of Technology and Innovation. I'll be playing the role of technology moderator for today's virtual meeting. On the panel with me is Don Crowell from the county attorney's office, who will be serving as process moderator. Before we start the meeting, I'd like to do a quick roll call and ensure that we have adequate communications for each commissioner. Commissioner Eggers, can you hear me okay?
Yes, I can hear you fine. I'm here. Thank you.
Excellent, thank you. Commissioner Seal.
It could be a bit louder, please, but I can hear you.
You may have to turn it up on your device, Commissioner.
I have been doing that, but I'll keep trying. Thank you.
All right. Commissioner Welch. Commissioner Welch. Commissioner Welch, can you hear us okay?
I can hear you now.
Okay.
Sorry.
Thank you, sir. Commissioner Long.
I'm here and I can hear you loud and clear.
Thank you. Commissioner Justice.
Yes, sir. Thank you.
Commissioner Peters.
Oh, good.
Commissioner Gerard.
Good here.
All right, Madam Chair, I think we have a quorum. I'll now turn the meeting over to you. Thank you.
Okay, thank you. Well, I'd like to open this meeting with a moment of silence for those who are suffering from this disease, but also a silent thanks for our healthcare workers. Okay, thank you. We have two public hearings. Mr. Administrator, item number one.
So
Number one is case CW 20-06, a proposal by Pinellas County to amend the countywide plan map from recreation open space to public semi-public regarding 2 acres more or less located on the east side of the McMullen Booth Road, 900 feet north of Curlew Road. The public hearing was properly advertised. The affidavit of publication has been received for filing. No correspondence has been received. The matter is properly before the authority to be heard.
Okay, thank you. Do we have any people who would like to speak on this issue?
This time, all members of the public who wish to comment on this agenda item should virtually raise their hand by pressing *9 if you're on the phone, or by pressing the raise hand button in the Zoom application. Madam Chair, it does appear we have one speaker. I'm sorry, we have 2 speakers on this item. The first speaker is...
Wait, I just wanted to know if we had any.
I'm sorry.
Do we need a presentation on this, board members?
Rodney
We have
Chapman,
talked about this before.
Rodney Chapman is available if you want him to provide a presentation.
Yeah, let me get Rodney on real quick here.
Does anybody need a presentation? Okay, do we have proponents? Brian?
We have 2 that are raising their hand. We won't know whether they're in.
Okay.
Yeah, we won't know whether they're in opposition or.
Okay, we'll take it as it comes then.
Okay. Our first member of the public is Ed Armstrong. Mr. Armstrong, if you can go ahead and say and state your name for the record, spell your name for the record, and then let us know whether, no, I'm sorry, and that should be it. Thank you.
Okay. Good afternoon. I'm Ed Armstrong, A-R-M-S-T-R-O-N-G. I'm an attorney with the law firm of Hill Ward Henderson representing the applicant. My address is 600 Cleveland Street, Suite 800. I don't have anything to add for the record. Substantively, you've seen this before. But I would like to thank the board for allowing this case to proceed in virtual format. I understand it's not ideal for any of us, but I sure think it beats the alternative of just shutting down and having no hearings at all. And I just want to express, and some jurisdictions have done that, by the way. So I just want to express my appreciation to the board for allowing the case to proceed and other cases as well. Unless you have questions, I don't have anything else to add at this time.
Anybody have questions for Mr. Armstrong?
I
Okay.
have a question, Madam Chair.
Yes, Commissioner Welch.
The development agreement, was that in effect when this came to Fort Pinellas?
Yes.
Okay. No changes since then?
No, sir.
Okay, thank you.
Anybody else? Okay, can we have our, thank you, Ed. Can we have our next speaker, please?
Madam Chair, our next speaker is Ms. Cynthia Terrapini. Cynthia, for the record, please say and spell your name and let us know your address, please.
Good afternoon, board. My name is Cindy Terrapini. I'm the owner of Terrapini Planning Strategies. My last name is spelled T-A-R-A-P-A-N-I. I also, along with Ed, represent the applicant on this case. My business address is 128 East Tarpon Avenue in Tarpon Springs. I wasn't intending to make a full presentation, but certainly happy to if you need it or answer any questions you might have. Thank you so much.
Okay, thank you. Any questions? Okay, we'll close the public hearing. And I'll entertain a motion. Commissioner Seal, did you have a question or are you? making a motion?
Approval.
I'm sorry, say that?
I move approval.
Okay, yeah, your sound is kind of messed up. Do I have a second? Yes, Commissioner Peters. Okay, we have a motion by Commissioner Seal, second by Commissioner Peters. All in favor, say aye and raise your hand, please.
Aye.
Aye. Okay, that is unanimous.
No, it's not.
Oh, I'm sorry. I'm sorry.
I'm a no, consistent with my Fort Pinellas vote.
Okay. That item passes 6-1. I'll have to get used to that. Okay, item 2.
Hold on.
Go ahead.
Madam Chair, item 2 is a quasi judicial petition to vacate submitted by HSLD LLC for a portion of a 40-foot drainage easement lying in lot 62, St. Joseph Sound Estates. Since this is a quasi judicial hearing, all members of the public wishing to speak must be sworn in. As this meeting is being held virtually using communications media technology in compliance with Executive Order 20-69 and 20-91 and Pinellas County's Safer at Home Order, anyone who wishes to speak will be sworn in virtually. For those who wish to speak, if able, please raise your right hand. Do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth? Signify by saying, I do. The public hearing was properly advertised. The affidavit of publication has been received for filing. Letters of no objection have been received from the appropriate parties, with Bright House noting that the petitioner would bear the expense of any required relocation of its facilities. All interested parties have been notified as to the date of the public hearing. No correspondence has been received. The matter is properly before the board to be heard.
Okay, thank you. Do we have any speakers on the line?
At this time, any members of the public that wish to comment on this agenda item should virtually raise their hand by pressing *9 if you're on the phone, or by pressing the raise hand button in the Zoom application. And Madam Chair, we do have one speaker on this item.
Okay, does staff want to do a presentation, or does anybody want a presentation? No?
Let's find out that the person raising their hand may be the petitioner.
Probably. Okay. Okay, let's hear from them then.
I believe this is Mr. Nick Tenney. Mr. Tenney, can you hear us?
Yes, sir.
Okay.
I just wanted to let you guys know that I was here. Otherwise, I had nothing to say. I've already been in contact with Josh, and he's advised me that there's no opposition.
And Mr. Tenney, I'm sorry, for the record, can you spell your name, please, and also let us know whether or not you took the oath that was the clerk administered?
Yes, sir. My name is Nick Tenney, N-I-C, Last name is Tenney, Tenney. And yes, I did take the oath to affirm.
Thank you, sir.
Okay. Are there any questions from the board?
Move approval.
Okay, well, we'll close the public hearing.
Sorry.
That's okay. We have a motion from Commissioner Eggers,
Second.
second from Commissioner Welch. All in favor, please raise your hand and say aye.
Aye.
Are there any opposed? Thank you. Motion passes unanimously. Okay, we have a consent agenda items 3 through 12. Does anybody want to pull anything?
Move consent, Madam Chair.
Second.
Okay, we have a motion from Commissioner Long, second from Commissioner Welch. All in favor say aye and raise your
Aye.
hand. Aye. Are there any opposed? Okay, thank you. Item, where are we? 13. Mr. Administrator.
Good evening, members of the commission. The item 13 is an extension of the local state of emergency. As you recall, last Thursday, you extended the local state of emergency from April the 18th through April the 24th. The item on today would extend it from April the 24th until May the 1st. Now, obviously there's a lot of discussion regarding what Governor DeSantis is going to do. And we, at this point, we simply don't know in terms of how he either extends the order or not. What this item would do would be to extend our local order. And if he rescinds our local order, take us back to what we had implemented prior to his order, which is the safer at home policy. I do believe that we have coordinating our efforts with where the governor takes the state order is imperative. Obviously, right now, we, from all the data that we see, we are in a strong position to not exceed our hospital capacity. However, Dr. Cho's on the line, Dr. Jameson on the line, and the sheriff's on the line. We're still watching this. The models have changed. We're continuing to watch it, but as you have seen also in the paper today, we have concerns about some of our nursing homes and some of the outbreaks. Well, that is representative of the community. That's being introduced from the community. And in fact, as testing ramps up, we're going to watch very closely and see how that occurs. So again, this order would simply extend our order. If the governor rescinds it, it would put us back to where we were at before this order, which is our safer at home policies, where we put the red or the yellow flyers on every door. And extend our local regulations, our local orders along with that. And again, that is what we have before you for consideration.
Okay. Commissioner Peters.
Thank you, Madam Chair. So I have a lot of questions because I still have not changed my position from Thursday, and I still believe that last year you said you didn't want to, or last week you said you didn't want to make any changes because the model that you're watching said that we weren't going to hit our peak for 2 more weeks. And that was on Thursday. And then late Friday night, that model came out and said that Florida has already hit their peak. And I understand we have a problem in our nursing homes. And I have a couple questions on that, but I'm not there yet. So I don't want to forget about my questions for the nursing home. I still believe that it's time that we use our authority to open up some of the changes that we've done, since if in fact the models that you were waiting for to change have changed, I feel like we should be open things up. And I understand that you're waiting on data from the cities, and I understand that you're waiting for some more data from the Department of Health. That why do we need to renew this emergency order today when it doesn't expire until Thursday? Why not have another meeting on Thursday when we have more data that you've been waiting for from cities and from the Department of Health? And if it's time to open up our pools, which I believe it was time to open them last week, I still think we should open up today. Why not move this agenda item until Thursday, have another meeting, then you have all your data, then you can know for sure if in fact, we already know for sure we have plenty of hospital capacity. We already know we have plenty of ICU bed capacity. We know we have plenty of ventilators. That we already know. The model already said that we had our peak. It's already passed. I think it's time that we start letting people use their own private property on their swimming pools where they're paying monthly fees to use their swimming pool in their condos and in their apartments. And I think we need to be letting them do that. And I don't think we need to redo this emergency order until Thursday, when you have all the data that you need, and we can have a much clearer picture of what it is we need to do, since this doesn't expire until Thursday. And so I would ask and make a motion that you wait to vote on this until Thursday, or at least have another meeting on Thursday once you have your data.
Do I hear a second to that motion? Okay, thank you. Commissioner, Mr. Burton.
A couple of points. One, we do have additional information that we're collecting. However, just a couple of points. One, when people say that we've hit our peak, what they're referring to is a single day of new cases. And that's not the point when most people are talking about their peak. They're talking about peak hospital utilization. We're not supposed to hit that peak until April the 24th or 25th. Now, I also completely agree with you, however, from the models that we're seeing, we're not going to exceed our capacity within our hospital system to deal with the number of residents impacted by the coronavirus. So from that standpoint, you're correct, but the peak is not the single day. And in fact, what some are referring to as the peak was when what we believe is when data was released from private labs that spiked that one day. We've been consistent, if you look at it over an average of about 20 new cases per day. It's actually down today. It was lower the last couple of days. So those are all good trends. But I wouldn't say we're out of the woods yet. And so, yes, we're being, cautious, and we're watching. We do have a meeting. The sheriff, Dr. Cho, and I are meeting with our data group tomorrow. We're looking, there are a number of data indicators that are very strong. We're looking at, out of the testing that has occurred, that it's about 5 to 6% of our population is testing positive. However, and that's well below even what the state of Florida is seeing. So those are very good indicators for us, but we also recognize that we're at about 1% of our population being tested.
So I have a question about that data. You said we had 22 and it's down today. Is that including the nursing home numbers? And then I have more questions on the nursing home.
I would have to refer to Dr. Cho on that, and he's on the line.
The cases should include all cases altogether. If you look at the larger report on the data report on the website, it does break it down to specific staff and residents that were positive in the long-term care facilities. And,
okay, so Dr. Cho, I haven't seen that data. Could you again tell me where that data could be found? Because
so it's on the COVID website. There's the regular dashboard that's interactive that has the cities and the zip code information. Under that, there's a button called Data Report, and it's like a 400-page report. And within, I think the fourth or fifth page down is the long-term care facilities.
And could you tell me in the last 4 days from the nursing home how many tested positive, strictly from the Seminole one and then the Palm Harbor one?
I don't have that on me, but what we generally don't do in terms of the practices of DOH and guidance thus far is we don't break it down by the location in terms of the positivities per site. And I think we report it out right now via aggregate. So
we don't know if those 22 and the 20 and the 20 weren't necessarily the nursing home numbers and not community numbers?
It's most likely it's a combination of both. The nursing home numbers and the general population count.
And so my other question on the nursing home is, I understand on the phone calls in the morning that you feel that ACA, or some people feel that ACA wasn't responsive and effective in doing training to our nursing home facilities. And since we've had this problem in our nursing home facility, and Pinellas County seems to be in kind of an anomaly in the numbers, have we done anything to contact our nursing home facilities about appropriate protocol? That seems to not have been done in those facilities. And are the other facilities doing appropriate protocol, since it appears that these other nursing homes were not?
So what we obviously try to do on the front end is to work on the prevention piece, obviously. So what they've done is the ACA initially did make a call down to all the facilities. And what we're trying to do here locally is augment those efforts with the fire and then bringing in whatever teams we have. We've developed a pretty intricate task force, a great partnership, including hospitals, EMS, emergency management, the county, the Department of Health, to see what we can do more so to better train and have the staff at those facilities be ready, ensure that they understand the appropriate PPE procedures, making sure that their supply chains for those PPEs are adequate as well. So we are continuing to those efforts and trying to bring in what we can locally to enhance that.
Okay, thank you. I think we need to remember that those cases that are in the nursing homes are coming from outside. They're not beginning in the nursing home. It's the staff that's coming and going that's bringing it in because there are no visitors coming. Personally, I'd like to wait before we modify our order until the governor does what he's going to do. He's already said that he's going to let the current order lapse at the end of the month, but we don't know what the next phase is for him, and he doesn't know yet because his task force is still working on it. Rather than confuse the public and start picking at little pieces of our order, I'd rather see what. Commissioner Peters, did you have something to say? Okay.
Commissioner Peters, you're muted.
I said not at all, Madam Chair. I'm waiting to hear what all you have to say, and we'll have comments afterwards. Thank you.
Well, thanks.
Mayor, could I add something just to clarify, hopefully, at least one point? Just to be clear, what is before you all today, we did add some additional commentary in there, but this is to extend your basic local state of emergency. Now, keep in mind that that also carries with it extraordinary powers that counties are then able to operate under Chapter 252. So you do, in my opinion, need to take action on the local state of emergency, if nothing else today, because, for instance, that gives the county the ability to be a bit more swift in purchasing activities, for instance, so that if we were able to come across some PPE we could purchase, but it does give us a lot more latitude, not just related to restrictions on the movement of people.
But Jewel, this one doesn't expire till Thursday, correct?
This one expires this Friday. So what you would be voting on is to extend that from
Friday on, correct?
Through May the 1st.
Thank you.
Joel, what are the additional things that we're putting in this one?
Well, to be clear, in my opinion, nothing in here is really additional. What we did is we said we're extending the local state of emergency. We have inserted language in all of your orders that says basically this one, ratifies everything else you have adopted previously. Those things are all still effective regardless of whether you say you're ratifying it. We did say that if the governor's order expires on April 30th, all of your orders remain in effect. That is true regardless. We inserted that language in there to try to be abundantly clear to everybody, the public, and put everybody on notice as to what would be in play should that governor's order expire on April 30th. Keeping in mind, you all are meeting again on April 30th.
Anybody? Yes, Commissioner Eggers.
Commissioner Eggers, we can't hear you well. And you're not muted. I'll send up tech support to Commissioner Eggers.
Okay, how about now?
Much better, sir. Thank you.
Well, when you hit the wrong button, that's what happens. So it's nothing to do with tech support. It's right here. So anyway, I do like the idea of having another meeting and not waiting until, again, whether we extend the order for another week today, I think that's probably appropriate. But I also think it's appropriate to have a meeting, say Monday, Tuesday, sometime before next Friday. I'm assuming that the order is going to come down and it'll give us plenty of time to have some discussion on Thursday or Friday or some decisions. But I still think there's an awful lot for us to kind of talk about, specifically relating to metrics. that the county administrator and several people are going to be taking advantage of tomorrow. We need to start getting a better handle on that and having more discussion about where we're going to be heading before we actually have to make some decisions. So I certainly would like to have another meeting before the April, whatever date that is, Thursday or Friday of next week. Commissioner Peters said to extend the order. I don't really care about doing that necessarily. We can still do that today, but I'd like to have another meeting to have further conversation about this very issue that we're talking about. So thank you.
I would agree. I think we're going to have more information about what the governor's new order is going to say by next Tuesday than we will on Friday or whenever. Commissioner Welch?
Thank you, Madam Chair. I agree with Commissioner Eggers on that. I have a couple of comments. I think one way of looking at this is that the actions that we took were successful, and the social distancing and the safer at home order. And I'm really concerned that if we take a step back now, we might lose some of that positive benefit we've seen. So I want to be really careful about how we kind of reopen Pinellas County. And as has been said, the governor's order doesn't expire till April 30th. What has really concerned me, and I'm sure all of us, is that when we've been making these decisions, we assumed that certain safety nets would be there for our community, whether it's the payroll, the Paycheck Protection Program, or even just basic unemployment. I mean, 95% of the people that file, 1.5 million people in Florida, still haven't received unemployment. And so those folks are really hurting, and really just to put food on the table. So I really want to see where Barry is in working with the CARES Act money that's going to provide that $4,000 or $5,000 to families or small businesses, because those folks, what we thought they were going to receive from the feds and the state, they haven't. And that's a big hole there. And we had assumed they'd have that support while we were working in parallel. So that's one question I had for Barry. The second is on testing, perhaps for Dr. Cho. We received some information saying there'd be enhanced testing. There's one site in St. Pete this Saturday, and then May 2nd, there's another site at Bartlett Park. How are y'all and I saw the Department of Health was partnering with that, with the city. How are y'all determining where you're going to have this community testing, and what does it involve?
Well, as you sort of mentioned, I think some of the issues with the testing is the supply chain issues. It's not just the testing kit in itself, it's the collection swabs and the PPEs. So when available, what we're trying to do is expand some outreaches, like one-day event. It's for a limited supply by appointment. And as you mentioned, it's scheduled for April 25th at Childs Park, and May 2nd at Bartlett Rec Center. So we're going to try to do small events there. And as supplies if we were to get supplies, we'd like to do as many of these as we can, just to enhance it. And keeping in mind that at our DOH site in St. Petersburg and our Mid-County site in Largo, we do have some testing capabilities there as well.
Follow up, Madam Chair?
Yes, please.
Are you working with any other cities, Clearwater, Tarpon, on the same kind of event?
No. We started with St. Petersburg. We just got a little bit of more collection kits, so just working with that. But as supplies come in, we'd like to try to do more of these types of outreaches.
So the supplies are constraining your ability to do the testing.
Right.
Okay. Thank you, Madam Chair.
Barry?
A couple of things. One, the timing early next week would work out well, because we're still evaluating several things. One, the PPE necessary. We're just now getting to where we can supply all of the orders that come in for support for PPE, mostly from, as we've just seen with nursing homes, but also with some of the hospitals. And that's a good thing. But it took this time up to now to where that supply chain began to work. So we're just now seeing that come through, and we still don't have the testing, as Dr. Cho just alluded to. So we're seeing some of these things play out. I also asked for, as we think about how we reopen our economy, and that includes pools and beaches, I asked for all the cities to give us their thoughts and ideas. I thought that we should be inclusive, because in different parts of our community are impacted. Certainly the beaches have a unique perspective that may be a little different from the rest of the county. So we wanted to get their input on that, along with our thoughts, the sheriff, myself, and others, and our health experts, and coming to you with those plans. It would be ideal to see the governor's plan on that. And again, the task force recommendations aren't due to him until Friday. Will he come out that day and report it? We don't know. More likely it would be, Saturday, Sunday, Monday type of time frame. So, meeting on Tuesday would certainly give us time to be able to kind of flesh some of those issues out, have a better picture for us to make some decisions from.
Can you speak to the
Mr.
CARES Act?
The CARES Act, yeah, absolutely. So as we said before, the rules don't come out until when, the 25th, the 24th. And so it's based upon those rules. We're going forth, so we're preparing the plan to bring to you with the assumptions that we know what the rules are. We may have to vary from that depending on what actually comes out. But the idea is we're going to have it in place to where we can bring it to you for you to authorize it. You have to have findings as part of your order approving the final program. And so we will prepare those, and we could have those ready by next Tuesday to be able to discuss those.
Thank you.
Thank you. Commissioner Seal.
Commissioner Welch already touched on it, but going a little bit step further, the National Coronavirus Response, written by Dr. Gottlieb, goes into the triggers to moving to the next phase, and it's known as the state-of-the-art medical recommendation. And like I said, Commissioner Welch touched on it, but we're supposed to be able to test all people with COVID-19 symptoms. So when we have this meeting on Tuesday, we need to know how many test kits we have and how many people that can cover, because that number's been varying over many days. Yes, the other is, and this is not oftentimes talked about, but we need to be able to conduct active monitoring of confirmed cases and their contacts, which is similar to what how Hong Kong and Singapore, which I don't want to go that path in some ways, but that was how they were able to really reduce their COVID-19 cases. So certainly through all of this, I mean, I too want to be as responsive as we can to the public and to their requests to us. I mean, we still continue to have, as you know, emails that go on both sides of every single issue. And so I just don't want us to go into phase 2 without those qualifications and order that data that we need. And finally, I don't want to have to move back. I don't want to have cases start exploding and then we are shutting our economy back down and harming people. So I really want everybody to be so cautious and deliberate, because I think we have to do that with most abundance of caution. Thank you.
Thank you. Anybody else? Commissioner Eggers.
Yeah, thank you again. Just wanted to follow up on a couple of those comments as we get, if it sounds like we're going to have a meeting on Tuesday, and talking about the testing that was just mentioned, and the type of testing I think is important as well. Whether it's that same day results or it's still that week long kind of thing. So understanding that a little better, and maybe a little bit more understanding of the dynamics of our nursing homes, because it just seems to me that that is a real issue. I don't know how many nursing homes do we have in Pinellas?
We have over 200.
So 200 nursing homes. We found problems in 2 for sure. I know we're monitoring some other ones. And not only does that become the issue within the home and then probably our hospitals, but the folks that are taking care of them are also making the community at risk too. So there's some issues around the nursing home. So I'd just like to have a little bit better feel of the dynamic of the nursing home. I guess it's also assisted living, nursing home primarily, but assisted living as well.
Absolutely.
And the last comment I would make, I agree. I think that study that Commissioner Seal talked about, there was a lot of going back and forth possibilities, triggering going forward and then triggering going back. And I really, really don't want to go back. If continue to move forward carefully, cautiously. I know the folks will be a lot safer today than they would have been 30 days ago because everybody's gotten used to distancing and being responsible. And just asking for just a little more patience as we get some of this additional data hopefully by Friday, but certainly by Tuesday's meeting, where we can have further discussion and maybe even get an update on where the governor is on announcing his next step, so that we can be in sync. I think that was a great point, Barry, to be in sync with what they're talking about up there. Thank you, Madam Chair.
Thank you. Sheriff.
Just so you all are aware, and I hear the direction that you all are going in, but just know that we are seeing a lot more pushback and defiance out there as we're dealing with the beaches, the pools, the businesses, et cetera, and in the community. And so it makes it very hard. We need to ask people to give us a few more days if that's the direction we're going to go in. I wholeheartedly support waiting until we have the data. The data is important. It has to be right and as right as we can possibly make it. And we don't have that today. And we'll have that in the next couple of days. But I can tell you that in the last few days, especially, and especially over the weekend, is that it was rough out there. I was out there myself, and people were just flat out saying no. And they're being defiant to the deputies. And the level of cooperation is not there the way it was a couple of weeks ago. And hopefully Dr. Cho will be able to speak to this, but everything we've had discussions about, and my understanding of it is that this testing that you all are looking for is not going to be available where you can test everybody. And to wait for that, and what I'm seeing out there as far as the defiance level is concerned, and it's getting worse, that's something you need to be aware of, because we're going to have to make decisions as to what we do when people are defiant about it. And I don't want to, and I've not wanted to at all in this, to take any enforcement action. We had to do it one time, and I hope that's the last time. And that's because the guy was absolutely defiant and he asked for the consequences. But it's getting tougher out there, and you all need to know that.
Sheriff, I think, just from reading our email, the tone of those has also changed. And I think at least most of us could draw a direct line from that to the messages to liberate your state, which are just outrageous as far as I'm concerned. This is something that's happening worldwide, not just in Pinellas County, not just in the state of Florida. There are entire countries where you can't leave your home. And it's not just us that's doing this, but we're doing the best we can trying to keep people safe. And I appreciate where you are, but I do think if we set another meeting for next week with the hope of being able to relax things a little bit by the end of the month, that at least we're giving people some light at the end of the tunnel. Some businesses can start back. Let's just hope we're not making a huge mistake doing that. But I personally would like to see us do that with all good restrictions in place. Commissioner Long, did you have something? Commissioner Long?
Yes, thank you, Madam Chair. And I really do like your thought process that you so eloquently just articulated. And I think if we are able to leave this meeting today, messaging that our staff are working extremely hard to gather all the data that we need to make good, solid decisions, so that by, let's just say, May 1st, that takes us past whenever the governor makes his decision. It also gives us a day or two to collect our thoughts and figure out how we want to respond, that we'll be in a much better place to move forward. Certainly not without risk, because let's face it, we are charting new waters here, but that we'll at least have the data that we need to make intelligent decisions that are at least governed by data and not emotion, which I think is critical at this stage. So it gives our citizens an opportunity to know that there's hope and that there is an end in sight. Thank you.
Jewel, I have a question. So if we extend our order to May 1st, what happens? It doesn't automatically go away when the governor's goes away, does it? I mean, we still have to change it.
No, what you all essentially, and maybe we could bifurcate what you all are looking at. The local state of emergency, just in and of itself, is what gives counties some of the extraordinary powers you have in the event of an emergency. It's no different than what you would adopt, say, for a hurricane. You have obviously the other orders that you have adopted along the way that dealt with the beaches, that dealt with the safer at home. You also have the order that you adopted that implemented the governor's order. That order will expire when the governor's order does, but that's fine because it was intended to implement the governor's order. But your beach order would stay in effect for as long as your local state of emergency does, unless you change it. And really that local state of emergency is one that you do need to consider continuing, again, because of the extraordinary powers that it gives counties.
Okay.
And what you would be looking at today, just to be clear, would be from this Friday, April the 24th through next Friday, May the 1st, again, just for the local state of emergency.
Okay, but we could change that next Tuesday if we have some definitive date from the governor and when his order. I prefer to have everything be happening at the same time instead of putting out confusing things from the state and local. I don't know, Barry, I don't know how you feel about that, but.
I absolutely agree. And, I mean, just looking at how other states, I just saw, and there was an order, out of Georgia, and everybody's read about that, but there it prevents locals from doing certain things. So we really need to see the governor's order in terms of how it's written. So there's some underlying issues of whether we have some local, control for our unique circumstances or not. It just makes sense to kind of put it all together, and that's the reason we want to extend it. However, knowing that we'll come back early next week, we'll be in a much better position to have a more thorough conversation regarding different pieces.
Okay, thank you.
Just one more quick. Oh, Charlie.
Commissioner Akers.
I think. Let me just say two things real quickly. Yeah, I think, Barry, in addition to that information, let's just make sure that we're also finding out what our region's doing, what the counties beside us are doing on some of this stuff, just to make sure that, again, as we move forward next Thursday, Friday, a week from this Thursday and Friday, that we know what our neighbors are doing as far as beaches go and that kind of thing. I think that's important.
Great
and
point.
then maybe just be prepared to summarize the essence of the safer at home, because I think we are talking about moving forward. And it really is the place that we were before the governor's order. So before the governor's order, we had a lot of businesses were still working and providing their services and products as long as they were using the safe distancing. And I think to get to that point, they've already a month later they'd be so much better at that safe distancing. So that will be a really big part, just to make sure we're clear on that, as well as what the region's doing. So if we can have all that kind of conversation in total. Thank you.
Mr. Justice.
Thank you, Madam Chair. And I think that obviously we'll be in a better position after the governor makes his decision on how he's going to rescind his order. I kind of thought that we had kind of threaded the needle pretty well. Not severe enough for some folks, more severe for others. But it seemed like these small businesses that were one-man operations were kind of doing what they were supposed to do to be safe. And I thought we're in a good spot. So my question for Mr. Burton is, as you're thinking about the next 7 days and what you're going to bring back to us, are you thinking about a scaled plan of back to normal, to where safer at home, community pools, beaches, and how we would step by step that out over the next 2 weeks, 4 weeks, 6 weeks, whatever it's going to be, as we're thinking about the next meeting?
Absolutely, Commissioner. We're looking at not only how the governors would open up these businesses, and then we would need to ensure we have the social distancing practices, but in particular, beaches. There's been discussion. You saw what happened on the East Coast. They opened them up for limited hours. So is it limited hours? Is it full? Do you do pools and beaches at the same time? Do you implement, the social distancing practices, which obviously we would, and then getting with law enforcement about the enforceability of that. really want to seek comments from our municipal partners in terms of their thoughts on that. But yeah, putting all those together into a package that hopefully makes sense. But I would anticipate the governor would modify that order. I would certainly think a stepped approach, he has said that before, makes sense, which was where we were at before. So we certainly would like to be there in another week. We've got health professionals in both Dr. Cho and Dr. Jameson on the line. They're still watching. Like you said, we have 117 confirmed positive cases out of our nursing home. So we do have active cases in our community. We want to watch that. So being a little conservative, is the right thing to do, recognizing that, this has been a while and we need to open up the economy. And certainly the risk factors are not at these little, small one-person businesses. Obviously it's at the larger gatherings. And so hopefully with the modification of the governor's order, we'd be able to implement, I think, more reasonable measures that really focus our efforts around those risk factors and where large crowds can gather.
Great. Commissioner Peters.
Thank you, Madam Chair. So I just have a couple thoughts. I feel that we need to do this incrementally. And I really believe after watching the governor this morning that he's going to be opening up the state. If we wanted to do something incrementally, last week doing the pools would have been a good way. We could have waited, maybe done the beaches 2 weeks later to see if there was any kind of impact and we could rein it in. If the governor opens everything up next week, there's no way to do incremental. I'm disappointed and surprised in that Barry made it very clear he didn't want us to close the beaches, and now he's not willing to even consider opening pools up. But last Monday, I brought it up and you all said you wanted more data. And so Thursday, we talked about more data. We had more data. Barry said it was very clear that the spike wasn't coming. We're waiting on the curve. We hadn't hit our peak. I'm looking at state data that says we've had since April 4th till yesterday, where it's been basically a flat line with the exception of where the nursing homes are. And if you take those numbers and minus the 117, that isn't that big of a number. We got the model that he was so concerned about, came out the very next day and said that the model was wrong, that we peaked. And what I believe we have to do is give people hope. And they have to know that they're going to get the rights back. And I think that the more we wait, the more anxious they're going to get. The sheriff has already said that they're anxious. They're getting angry. They're not trusting us. And I just feel very strongly, clearly you all know that, clearly you all disagree with me, that people should have the right to be on their own private property in their condominium or in their apartment where they're paying money to use that pool that they can't use. I think it's time. I really think it's time, and that we can trust the people of Pinellas County. They have made it very clear that they've been social distancing. They are afraid to get sick. Nobody wants to get sick. If any HOA didn't want to open or any apartment didn't want to open, they certainly have the right then to not open. But I truly, truly believe that this would give us an incremental thing. If we open up the pools, we got another week and a half before the governor's order, that may open up everything. And at least that gives them hope that, and then we have some kind of incremental, and we know, are they going to be responsible on the beaches? Who knows? But at least if we give them the opportunity to have their pool, we give them hope. I don't think waiting another week or another week and a half, because if you're waiting till next Friday until the governor makes a decision, that's almost 2 weeks without hope. And 2 weeks is a very long time. And I truly, truly believe we captured data. And the sheriff called me on Sunday and said he'd have data on Tuesday. It's Tuesday, he doesn't have the data. And I'm very, very frustrated, as much as the citizens are that emailing us and the citizens out in the community that are very frustrated. And I really believe that we're the ones that are the leadership that be showing that. Now, clearly you disagree with me, and that's fine. But I think we're doing a disservice to the citizens by not doing it incrementally. And I think that giving them the rights to have their pool back, the only thing we have power and authority on is what we did. We have no power and authority to open up businesses until the governor decides what he's doing. But we do have the power and authority to let people use the pools. And I really think that we should do that. Again, I know you disagree with me, but I just want to get my last words out there. I think by doing what we're doing and waiting until the governor opens every single thing up, then we have no increment, no nothing. And when I look at the data that the Department of Health has right there, we have from April 4th to April 20th, where that line is flat with the exception of our nursing home. And absolutely, we should be paying attention to our nursing homes and doing everything we can to make sure that they're safe. But I still believe that we should give people a release, and we should give them the opportunity to swim in their pools, and we should give them an opportunity to have more faith and hope in our commission and letting them know that their rights are going to be restored. That's just my opinion. I know you disagree, but thank you for letting me have my last rant.
You have said that a few times. Commissioner Long, did you have your hand up? Or are you just fiddling with your computer?
No, actually, I'm just sitting here quietly listening.
Oh, I thought you had, yeah, okay.
Sorry.
Oh, Mr. Eggers?
Yeah, just Commissioner Peters is, I mean, I think every single one of us feel the way you do, Commissioner Peters. So don't exclude us on that. It's all about timing. You've quoted several Department of Health numbers. And so I'd like to hear from Dr. Cho because, you know, quite frankly, short of having numbers and short of having the Department of Health, our representative here locally saying that we're good. And I'm assuming that this won't have any enforcement concerns on the sheriff's part if we were to open up the pools. But I'd like to hear from each of those folks, just you know, the numbers. I'd like to hear from Dr. Cho, and I'd like to hear from the sheriff as it relates to the pool issue that you've raised. So that would be helpful for me.
Okay, if you could hold on just a sec, Commissioner Welch.
Well, I was listening for the answer to Commissioner Eggers' point. I'm kind of going in a different direction. So if you want to call me after that answer.
Okay.
Okay.
Dr. Cho, sorry.
So in terms of the numbers, as Commissioner Peters mentioned, we have been fortunate, and I do believe the social distancing efforts that we've done here, the Safer at Home, has been working. Hence the flattening we've seen here of the past 2 weeks, essentially. The biggest concern in my focus really has obviously been the long-term care facilities and what more we can do to enhance that to protect these congregate living, especially on the most vulnerable population here. So that is the focus. Now, in terms of some of the data, I know the county staff and the sheriff's staff we're working on trying to come up with the best in terms of looking at the data as to when would be the best to pull back. And I agree with you, Commissioner Peters, it has to be incremental. I think hopefully the data, and again, we're meeting tomorrow, will tell us the when, but I think the how is another question as well. I think it has to be a phased approach, if at all possible. And obviously, there are things out of our control with the governor's policies. But looking at it in a phased approach, if there are elements of social distancing, I know the documents that Commissioner Steele mentioned and some of the other governing bodies do recommend that gradual phased-in type of approach.
Dr. Cho, can you talk about the downside of opening the pools at this point if we did that with no hanging around poolside, you know, no sunbathing, just get in the pool and get out?
It's hard to predict if someone's going to flock and people are actually violating that social distancing. That could be an issue. But if you open the pools and everyone's abiding by it, would it make a huge impact? We wouldn't know the results of that. Unfortunately, any policy decisions that we make in terms of social distancing, which makes it tough here, is that any policy decisions, we won't see the impact for about 7 to 14 days. So it's hard. It's making that educated risk, understanding some of the risks. And then more than that, when we back down on some of those social distancing measures, what are some of the markers we're going to monitor to see if we are starting to trend up even before the cases are confirmed positive. So some of the things that we're looking at our end is things like syndromic surveillance. Are we seeing an uptick of flu-like illnesses coming up again? So my EPI team will be monitoring that in coordination with our overall plans for reopening.
Okay, I guess, you know, if we're talking about a week and a half from now, going back to purely social distancing, I don't know that there's much of a difference if we just open the pools right now a week and a half earlier. I don't know. But I'm sure Sheriff Bob is going to tell us right now.
Well, as I said, I want to see the data tomorrow. I can tell you that, and I've been immersed in this from what I've seen in the data the last couple of days, but we need to have it all verified in what we're going to receive tomorrow. Yesterday in Pinellas County, there were 10 cases. Day before, there's 12. Day before, there's 17. It has been flat. Is it a steep downward trajectory? No. And it hasn't been on a state basis either, but it has been going down or at least flat. As far as the pools are concerned, since Commissioner Eggers asked my opinion on that, is that if this data bears out the way that I think it is going to bear out tomorrow, and we have it, and we look at another big metric that I want to see, is the percentage of positives over the last 14 days. And I haven't seen that, because if the percentage of positives, so you take the total number of tests being done, and if the percentage of positives is flat or going down, and certainly not going up, then that's a very strong indicator. And the greater the number of tests that are being done and the lower the percentage of positives, that's also a strong indicator. We don't have that data before us. And so once we see this tomorrow, if the indicators are the way they appear to me to be going, then I would support opening the pools. And I think that just having people going for an exercise swim is not going to change this dynamic. One of the things that I've come to the absolute realization about in this process is this is not about risk avoidance. We cannot avoid risk. Is that it's about managing the risk, and it's about the degree of risk that we're willing to take. And one thing, and Dr. Cho has said this, others have said this, and I absolutely subscribe to it, is that when we relax, it's not if, but when we relax this, we are going to see an uptick. And the uptick question is whether it's within tolerances. One of the things we know for sure, and I have seen the data on this, is that even in the worst case scenario, is that the hospital and first responder system, but especially the hospitals, is that it is absolutely within their capacity. So that's a very important thing that we did not have last week. We did not have that. And so it's changed this week for me based upon that information and based upon where I think this data is going to take us. So I would, not wait till what the governor's going to do. We don't know what he's going to do. We have no idea. And if history holds true, is that he won't do his order until the day it expires. That's what he's done with everything else. Look what he did with vacation rentals. They expired at midnight and the order came out at 5:01 p.m. So, the history here, I don't know what he's going to do. And so, and then we're in a situation where are we going to, if he reopens the businesses, are we going to say we want to take an incremental approach? So we're going to leave the beaches and the pools closed for another 2 weeks. I personally don't think the community is going to tolerate that. Yeah. And so that's where I am on it. But I don't think we can really have this further until we have this data tomorrow, and we really have time to look at it, talk about it, digest it, and see if it's taking us where it appears to be taking us.
Okay, Commissioner Long.
Thank you, Madam Chair. So from listening to everyone's comments and the comments that the sheriff just made, it seems to me, and I think I heard us talk about the fact that we're going to be meeting again on Tuesday. And by Tuesday, we'll have the data that the sheriff is waiting on. We'll have the data from our municipal partners. So it seems to me by Tuesday, we should be in a better position to make an educated decision with regard to at least opening the pools. So why don't we stretch for that? We let our citizens know and we go forward from there, because at least that gives us a little bit of relief, especially for those folks that are relying on their pools for exercise and health reasons. And that would be my preference. If there was an opportunity to move on that, I'd be happy to.
Commissioner Welch.
So a lot to process there, but let me ask a question about, so the sheriff mentioned we had 10 new cases yesterday. How were those identified as new cases? What was the process? Was there a test? Was there somebody that went to an ER? And maybe that's for Dr. Jameson. I don't know. How are these folks identified?
Dr. Chester, Dr. Cho. Yeah.
Okay.
Dr. Jameson, Dr. Cho.
So in terms of the day-to-day numbers and how that's reported, and I think we've spoken on this before, the challenges is since the private sector has ramped up some of the labs, we don't necessarily get them until we get the results into our system or when it's reported to us. So what you're seeing, like for example, today's numbers for us as a county is reflective of when they did the test and how fast the test came back. So did I answer your question?
Yeah, you did. It's really imperfect data. And, we talked a while ago that we'd only tested 1% of the folks in Pinellas County. And as we test more, those numbers might change significantly. So, I agree with what's been said that we don't have perfect data. And I'm not supportive of opening the pools or the beaches until we've got better information. And in my mind, we get a ton of emails and a lot of them are compelling, older folks who need the therapy of swimming in a pool and those kinds of things. But there are a ton of people out there on the trails. If you've been out, I mean, folks are getting out there exercising. I kind of put that recreation piece in a different category of desperation that a lot of our businesses and families are in because they're not getting unemployment. They're not getting the paycheck protection program money. These folks are out of money. And when the sheriff speaks to pushback, that's really what I'm focusing on. Folks are getting desperate because those other safety nets are not working. And so that's really where my concern is. Again, Barry, getting that CARES Act funding on the street as quickly as possible. I think that's where the serious pushback is coming from. And Chair, I agree, the rhetoric from the White House is not helping that situation at all. But that's where I think we've really got to be able to help people, get money, get food on the table, take care of their basic needs. And I think that's driving a lot of the pushback that we're seeing. But for right now, I don't support opening the pools or the beaches. Maybe next week when we've got better information. But that lag in the reporting, that lag in the impact of community spread based on what we did is still showing up in those numbers. And I'm not prepared to do something that might move us backwards at this point. Thank you, Madam Chair.
Okay, Commissioner Eggers.
Just a quick question. We're talking about Tuesday, and even for people who are trying to be as patient as we can, that it seems like a long way away. Another five or so days. Is there any? Could all of this be done Friday, or is that just pushing too hard on all the information that we're asking you to do? I mean, even Monday. I mean, each of these days matter, and just if we're not ready, we're not ready. I don't want to push you, where it's not reasonable. So just ask that question.
I was only saying Tuesday in the hopes that the governor would announce where they're taking the state and the task force recommendations, which are due back to him by Friday. I'll receive the information from the cities by Thursday. So we'll take a look at that. Obviously, we have ideas and thoughts, as I just shared with you. But I want to be inclusive of their thoughts also. And so we can put that together and bring and share that with you, kind of everybody's thoughts. So Monday, yes. I mean, Tuesday, yes. We were just trying to be able to have enough time to be able to put all that information together. And also giving the governor time to act on if he does, and that's an if, but was hopeful that he would let us know where he's taken the state order.
Yeah, but again, the challenge would be that you guys look at these numbers tomorrow and you start to see some strengthening behind some convictions to go in a direction to provide some pressure relief, like opening the pools. I just hate to wait all the way till Tuesday. I mean, if that's something that we can do that provides a little bit of symbolic hope to a lot of people because they're not going to be affected by it, but actual hope to some. I mean, I think that's something that I hate to wait till Tuesday if the numbers that we're talking about. And again, I haven't heard from Dr. Cho that, he agrees with the sheriff's number of the percentage of positives over the last 14 days. You guys will have that conversation tomorrow. You'll look at numbers, you'll have that conversation, you'll debate that. But if you all agree with that, I just, there's a part of me that says we ought to go then and open those pools up. And not wait for another 4 or 5 days and a weekend and all of that, if those numbers are what they say they are. So That's my only concern about waiting till Tuesday, but thank you.
Commissioner Long. Commissioner Long.
Yeah, thank you. Thank you. Excuse me. Thank you, Madam Chair. I'd just like to remind everyone when we talk about opening up those condo pools, there's no liability coverage on that portion of a homeowners association. And so without knowing the risk that we're talking about, that the data the sheriff is looking for will at least give to me, I would not be willing to vote on that today. I want to see the data.
I agree with you. I agree.
Thank you.
Just so you know, that the lag in the data, Commissioner Welch, is not going to change. That lag that we've had in the data has been here, and that lag is not going to change, just so you're aware. It's a product of the testing, the way it's being reported, so just so you know that.
I'm aware of that.
Okay.
Thank you. I guess we're ready to take public comment.
No, Madam Chair, I
Sorry,
had one comment, Madam
didn't
Chair.
do.
I had one comment, and I'd appreciate it if you'd let me have a chance, because when I started my
Sorry,
statement.
I did not see you raise your hand. It's kind of
Sorry,
different.
I was waving it, so sorry. But so when I opened up my comments the first time, I suggested that we wait on the emergency order when it expires on Friday to vote for it on Friday. And if we waited to vote for this emergency order on Friday, we would have the data the sheriff wants, we'd have the data that Barry wants from the cities, and that would give us an opportunity to, at least if the data and what the cities want concur, we could give people hope and let them in their pool by Friday. And then we could do the emergency order on Friday. There's no reason to do it 5 days in advance when it doesn't expire until Friday. So why not wait until Friday and vote? Then we'd have all the data and we can give people hope, start incrementally opening things up. If the sheriff is correct and the data is going to say what he says, then that can at least start some kind of incremental something, because otherwise the governor may next week say that all businesses are open and then there's no incremental anything. And at least we can give our people hope this week and not have to wait until Tuesday next week when the governor may open everything up on Thursday. So I just think that that's a great option when we have more data and it gives people more hope and we can start incrementally. I made a motion. I didn't get a second. David, that's a second. I think that's great, but I didn't want to let this go until that was said. Thank you.
I would certainly support having a meeting on Friday. You know, it's not like we have a whole lot of other meetings going on and a whole lot of other events to do. And so I don't mind, having us put, again, leave it up to Barry. You call the shots on the operation side, but having a meeting on Friday seems perfectly okay to me. And we may get to that point and have a quick peek at the analytics. We may not have all the other information together that we're going to have on Tuesday. It's actually going to be that conversation that Commissioner Welch was talking about. And we may not know the governor's stuff on Friday, where he's going to be. That may be a better part for Tuesday, but if there's a short meeting on Friday to discuss this issue and the metrics a little bit, because you will have had time to do the metrics, I would be fine with that. I have no problem having another meeting on Friday.
Commissioner Peters, was that your original motion?
My motion was to not vote on this emergency order because we don't have to today. We have to by Friday. So it was to move this agenda item to a meeting on Friday where we'd have more data and more information. And before we renew that emergency order, then we could change some of those orders if we want to change the pools. Or, I don't see us changing playgrounds. I don't see the sheriff supporting beaches. But if we could give some kind of incremental start and we give people hope, and we did it on Friday because we'll have more information. Sheriff said he'll have his tomorrow. Barry says he'll have Thursday. So if they have that all by then, and Barry could even ask the cities to give it to him by tomorrow rather than Thursday. So I think if the emergency order expires on Friday, renew it on Friday. So my motion was to not vote on this emergency order today, but to move it to Friday to guarantee we're meeting on Friday, and that would be the conversation.
And I just had one question for Barry, and then I'll be willing to second that. Barry, will you be able to get, I think the conversation on Friday needs to be about the metrics that you guys get tomorrow and the comfort levels that you have with the metrics to be the kind of the focus for Friday. If you've got that information, or you think you can have that, and you think you can have some input from our partners, our city partners on this, I think that would be the reason to have the meeting. And then we can, if the numbers are there, we can discuss and consider the pool issue. I don't necessarily want to be saying that we're doing the pools on Friday. I think what we're doing is we're going to see if the metrics are there to start getting comfortable with the metrics and see what our partners have to say. And oh, by the way, if everything looks good and looks okay, that may be an incremental step. That's just my take on it. So, and I would second it but I'd like to hear your answer.
That's exactly what I was saying. I think you articulated it better. Thank you.
I think we're going to be able to look at data, and we're trying to dissect available data and try to get community trends and understanding what's occurring in the community. That is not a perfect science at all. And so we're going to be able to provide to you different metrics that we can use. Some of the things the sheriff and I have mentioned here today, percentage of positive tests, numbers, and things like that. So we certainly can provide that by Friday. The real question and how I kind of opened up is we wanted to provide a single strategy that's thought through in terms of how do we open business, how do we open pools, how do we open beaches, and do that in coordination with our municipal partners. You know, we've heard everything from when we open beaches, please don't just open the beaches and keep the parking lots closed, because there are communities where there's a significant impact to the residents if that occurs. So each one has a different impact. And just like with pools, each one has a little different impact. Are we talking the impact that will occur down on the beach pools at the hotels, or condo pools where you got, 10 residents in it? It's very different. So we just wanted to look through all of that and come to you, with the most informed strategies. Can we provide pieces of that on Friday? Sure. We just won't have everything.
I have you. But meeting on Friday does not preclude us from meeting again on Tuesday and talking about the larger plan.
No.
How to incrementally phase back in, whether we do the pools on Friday or not. We're still going to meet on Tuesday to talk about the bigger plan. Is that right?
We certainly can do that.
Okay. Commissioner Long.
Yes, Madam Chair. Commissioner Seal and I have a T-BARTA board meeting on Friday morning. FYI.
Okay. Great. Commissioner Welch.
Well, I don't support the motion from Commissioner Peters. I don't think we're going to have, we're going to have 2 days more worth of data on hospitalizations and infection rates. That's not going to change my thinking on it. We've got 9 days until the governor's order expires. Our staff is already working on 100 different things, including how to deal with the CARES Act money. I'd rather have them concentrate on that. We have, and the other question was, if the governor opens up all businesses, I think we still can be more restrictive. That's what our safer at home order was in the first place. And so we still have the opportunity to be incremental in opening back up. So I don't support that motion. I think we're on a good path. We just need to ask folks to be patient for another 9-10 days. Let's see what the governor is doing. And again, in my view, the emphasis ought to be on the businesses and the families who are out of money and need that help right now. I'm not as focused on the beaches and the pools right now, so I don't support the motion.
Okay. Yes, Commissioner Justice.
Thank you, Madam Chair. I think I'd rather take up the motion, the original extending of the order today, so we have it done, so that we're not worried about, we can always change our mind on Friday or whatever, but do the order today so that we have it done, we make sure of it. And quite frankly, by saying we're going to come back Friday, all that has done is made everyone think we're going to open up everything on Friday. And you thought you saw a lot of emails before, you're going to see a million times more between now and Friday. And after this morning's emergency phone call, I just think we're starting to get a little ahead of ourselves.
Thank you. I assume we have, yes, Dr. Jameson.
Thank you, Madam Chair. I've been pretty quiet, but I just wanted to offer a couple of thoughts. First, I'd like to congratulate you all and the entire community for just an amazing job going through in our long-term care facilities, and which are part of our community as well. And finally, I would say I happened to be working a shift in the ER the day the governor's order came out. And every healthcare professional that I was with that day said, it's about time. And this is all about time. It really is. I think we need just a little bit more to get a handle on this.
Thank you. Anybody else right now? I think we probably have some public comment. Brian?
At this time, members of the public who wish to comment on this agenda item, virtually raise your hand on the phone by pressing *9 or by pressing the raise hand button on the Zoom application. Madam Chair, it does appear that we do have some participants that wish to speak. The total number is 7. Hold on, it's going up. We have 10 members of the public that wish to speak, Madam Chair.
For the wishes of the board, do we want to give everybody 3 minutes?
Madam Chair, if I could just quickly interrupt, Dr. Cho has another meeting to go to. Is it okay that he jump off the call, or are there any additional questions for him?
No, I think that's fine. Thank you, Dr. Cho. Okay, 3 minutes.
Okay, so we'll start with our first member of the public. This is someone that comes in on the phone line, last 4 digits 2308. If you could go ahead and identify yourself, say your name, spell your name, give us your address, and then you'll have 3 minutes to speak.
Hello?
Yes.
Can you hear me?
Yes, ma'am.
Yes.
Hi, this is Maria Gotsis. I'm in Safety Harbor, Florida. And thank you very much, Board of Commissioners. I stood before you last month. I'm the hairdresser. And last week, Mr. Burton, you talked about contacting the State Emergency Coordinator Officer, which I did. And I also wrote a letter to Governor DeSantis and also Lieutenant Governor. And I spoke on the hair salons in the area, especially my salon, which is a one-on-one hair salon. And I gave some statistics about Pinellas County, being that we have over 969,000 residents, and that we have definitely flattened the curve. And when we were doing the Safer at Home order before he closed down our facilities, and that we were doing a great job, that the sheriff was very, he thought we were doing a really good job with, social distancing. And the governor actually at one of his briefings mentioned my statistics and said that he would like to see us reopen. And this morning on Fox and Friends, he also spoke about Pinellas County and using the reopening of the Florida Task Force. So I was very encouraged with that. I would like to see the Safer at Home order come into effect again. And, this has been totally devastating. I have not received any federal aid. I've not received any unemployment. It's been just devastating to me. I don't want to get emotional right now, but with all this stuff about the pools, it's unbelievable. I don't know what you're saying about hope. Opening the pools is going to give people hope. Well, let me tell you, what's going to give me hope is getting back to work. Not opening a pool definitely is not going to give me hope. Putting food on my table, paying my bills, putting lights on, paying my mortgage is what's going to give me hope. It's just a shame to see how hundreds of us in this case where we are is where I was living paycheck to paycheck before, and now being unemployed now going on 2 months is just unbelievable. So I hope as of May 1st, when Governor DeSantis and his task force has us reopen, I hope that we can go back to the safer at home order the way we had, and where the Congresswoman Pat and the sheriff, had us working. We were wearing masks.
I'm sorry, your time has expired.
Okay, thank you very much, and thank you for all your hard work. And I do not support opening up the pools and the beaches at this time. Thank you.
And ma'am, I'm sorry, just for the record, can we get you the spelling on your name, just for the record, please?
Yes, it's Maria, Maria, Gotsis, Gotsis.
Okay, thank you so much, ma'am. Okay, Madam Chair, our next speaker is Amish Patel. If you could go ahead and say your name, spell your name, give us your address, and then you'll have 3 minutes. Thank you.
Yes, my name is Amish Patel, Amishpatel, and I'm the manager of 2 hotels in Pinellas County. One is at 20788 US 19 North. Commissioner Eggers, you and I have spoken about potentially using my properties as a quarantine area in the past about a week ago. But my main comment for you guys is that I agree with keeping everything as is because my employees are scared to come in. And until we have enough testing, my housekeepers, my front desk staff, they're very scared about who's coming in to rent a room because they may or may not have COVID-19. We don't know where they're coming from. And if we open up the pools, that's only going to allow people to come congregate. So until we can have enough testing to say that Pinellas County, its residents, its employees will be safe, I find it very difficult for you guys to even allow or think about opening up any aspect until we can make our residents and employees safe. Also, Commissioner Welch, I highly agree with you that the focus should be on getting the money from the CARES Act to help all the different businesses that have been affected, whether it be a hotel, we employ about 15 people per property, or the hairdresser or the barbershop. Let's get the money and help everyone stay in business, pay their rent, pay their employees, put money on the in their bank to help pay for food. Anything we need to help our residents, I fully agree with, and hopefully you guys can take that into consideration and take all these little petty things, put them to the side, and work about putting money into people's pockets to help them get through these tough times. Thank you very much. That's all I have to say.
Thank you.
Thank you. Madam Chair, our next speaker is Tara Pickens. Ms. Pickens, if you could go ahead, say your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, my name is Tara Pickens, and Tara, T-A-R-A, Pickens, P-I-C-K-E-N-S, and I live in Clearwater. I thank you guys for your time and consideration, and I just ask that everyone please try to consider things from everyone's perspective. At times it feels like not all voices of Pinellas County are being heard fairly and equally. There are those of us in Pinellas County that wholeheartedly support not only the pools and beaches, as I know people seem to think that is petty. A lot of us support the businesses reopening, even with the use of social distancing. So many people are without jobs and without food and without shelter, and there's so much more to be taken into consideration right now other than just the virus and the effects of the virus, which we know those are all, bad, and the effect on the nursing homes. But there are also citizens that are losing everything. I'm fortunate enough that I have a job. My husband is fortunate enough that he still has a job. But on the other side, where some people think that opening the pools and the beaches is a petty thing to worry about, I urge you to take this into consideration. I have an 11-year-old daughter with a severely debilitating connective tissue disorder. I moved to the state of Florida 2 years ago so that she could swim every day, so that her condition would not continue to deteriorate. I live in an apartment home. My 11-year-old daughter is unable to swim in that pool. And every day that she's not in the pool, where you say days don't matter and 4 days don't matter and 5 days don't matter, well, they matter to my family. They matter to my 11-year-old. And I know that I'm not the only one in this community with a special needs child or with a health condition that the closing of the pools is affecting. I believe that the citizens of Pinellas County can reopen certain things and that we're responsible enough to follow social distancing rules because, again, no one wants to get sick. My daughter has a compromised immune system as well, but we practice social distancing and good hand hygiene 12 months out of the year, because just as the coronavirus can kill my daughter, so can the flu. So we use those practices all the time. And I urge you to think about things from everyone's point of view. I know people are scared, but I don't feel like the data justifies the complete county shutdown that we experience now. And I really appreciate all of your time and all of the consideration and hours that you all put in. And I just urge you to please consider reopening the pools, reopening the beaches, and getting our citizens back to work. Thank you.
Thank you.
Madam Chair, our next speaker is on the phone line, last four digits 0255. If you'd go ahead and say your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, my name is Brandy Long. First name Brandy, last name Long. I am a business owner in the tourism industry and also a medical provider with our most vulnerable population, the long-term care facilities. I see two sides to the governor opening the state soon, which we all know that he's going to do. I'm in favor of keeping all of the restrictions as is until he makes the decision on the 30th. I feel like we're just basically being able to use our time right now to be able to get our numbers as low as we possibly can. And I think that's the smartest thing to do. I have a little bit different perspective on this. I would like the commission to try to think of forward on whether or not to wear masks when we come back into the public, whenever our businesses are open. And I'd like for the idea of a mask requirement in public places where 6 foot cannot be maintained. It's something that might be able to help our more vulnerable citizens that can't have help going to the grocery store. They have to get out on their own. I'm not asking for masks to be worn whenever they're bike riding or going to the beach or in places that you can stay away from others. It just basically would allow you to protect your neighbor and for your neighbor to protect you. Imagine the grandma or grandpa that moved here after retirement and then they just don't have anybody for them to help them. By wearing a mask, you might be able to save their life. And the 117 people that have this, that are in our long-term care facilities and assisted living, they matter. And the hope that we can give them that we're doing our absolute best and looking forward to what we can do to help stop the spread is really important. I think that will give our community more hope than opening the swimming pools, honestly.
Thank you.
Madam Chair, our next speaker is Axel David. If you could go ahead, say your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, Brian. This is Axel, AXL. My last name is David, DAVID, and I'm at 400 Pennsylvania Avenue in Clearwater. Can you hear me okay?
Go ahead, sir. Yes, you have 3 minutes.
Oh. I just want to echo maybe some sentiments from the sheriff and also the comment in response to statements made by Dr. Jameson and a couple of commissioners. The safer at home orders were intended to flatten the curve, which was, as we were told, to drag it out longer so that the peak never exceeded the care system capacity. We just heard the county administrator say repeatedly earlier in the meeting that, quote, we're in a strong position not to exceed our hospital capacity. The safer at home orders were never intended to stop or eliminate the spread of the virus, as had been mentioned by several people in the meeting. Going to pools, regarding people congregating around it at their condo or HOA pools, it's going to really be really nitpicky. The same people that are going to congregate around the pools are the same people that are going to congregate in their backyards or living rooms anyway. I think Commissioner Peters is absolutely on the right track here. But my question is, why would you trust those that are privileged enough to have access to a private pool, but you wouldn't trust everyone else to go to the beach for the same reasons? The other 99% of residents in Pinellas County have the same exact health and mental needs and exercise needs to go to a pool or go swimming to, whether it be the beach or pool. So there's that disparity there that I'm really not liking with the people that can afford a pool, have access to a pool, where 99% of the residents don't have that. Our pool is the beach, and we have those needs too. We keep hearing 2 more weeks, 2 more weeks, 2 more weeks. I would submit that we had to have a plan within a week to reopen not only the pools, but the beaches too. I mentioned last week, and the media really twisted some of your comments around, make it look like we were going to just have a big old party on the beach. you can incrementally open the beaches with distancing, enforcement of big crowds and all that. So I would really encourage to have a conversation around opening the pools, have that also occur with opening the beaches too. Those that don't have a pool have those same needs as those with a pool. And that's all I have to say. Thank you for your time.
Thank you.
Madam Chair, our next speaker is Cheryl Corey. Cheryl, if you could go ahead and say your name, spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, I'm Cheryl Corey, SHERYL I'm a business owner here in the city of Clearwater. I am an owner at Hassel Florist, and I just do not understand why we, as a business that's been in Clearwater for 61 years, offering delivery services, is not allowed to operate at this time. Every other county in the state of Florida is able to operate their florist except for ours. I continue to get mixed messages from the tip line in Pinellas County, as well as the sheriff's tip line. I have a deputy that yesterday told us he would be at our business every day monitoring us. I feel this is harassment. Plenty of businesses, plenty of florists are opened in the city of Clearwater as well, yet we feel we're being targeted. Our doors have been closed since the governor ordered it, and I wish that Pinellas County would let us operate as a business that is offering delivery service only. I do thank Ms. Peters for her support of local businesses and our community beaches and pools. Thank you.
Thank you.
Madam Chair, our next speaker is Jonathan Luz. Mr. Luz, if you'll go ahead and say your name, spell your name, give us your address, and you'll have 3 minutes to speak.
My name's Jonathan Loos, L-O-O-S. I'm in Madeira Beach. There's a lot of conversation here with, you guys have a complex task, right? You're balancing the, making sure you don't undo the great work that it appears that we've done. I think the businesses are going to be a complex task, the beach complex, but I think Kathleen Peters is correct, and I think Sheriff Bob is correct. Let them eat cake. You got to throw a bone. You're talking about opening private pools on private property that's not widely accessible to the public. And I do want to mention that there's a great inconsistency that I'm seeing with this board. You'll play both ends. You'll say the governor's order is there, we've got to be restrictive, yet the county decided to impose or interpret the restrictions that they are putting in. You want to see what others are doing for the beach. Why don't you look to see what others are doing for the florists, for car washes, for, and particularly pools. Pinellas County decided to close their pools. The other call is for data. And, there is no data that supports the shutdown of pools. There's no connection to data or reality. There's no evidence of the virus transmitting via water. All the evidence supports that outdoor activity is good for health, that it sanitizes the surfaces. So you're not really opening in pools. You're doing what Governor DeSantis did to you. He decentralized to let the counties handle things themselves. And all I think is being asked, and I think what Commissioner Peters is saying, is give the power back to the homeowners association to be able to make that decision what's best for them. And I do want to say that the sheriff is right with the testing. The previous talker, Axel David, the flattening the curve is taken out of context. This was never meant to stop. It was meant to suppress, to make sure that the inevitability that you are going to get sick, you are going to get COVID-19, you're just going to have the medical resources there to save you so that we can get through it. The same thing with the testing. I think it's being taken out of context. People want testing, but think of the practicality of that. If you're waiting for 10 million tests to be done, or I'm sorry, 1 million citizens in the county, you got to do that every single day. And the testing is really meant to do this contact tracing to isolate, not meant to be getting back to work. So if you're putting all your weight in this testing aspect, it's going to be a long time. I think Governor DeSantis is spot on with the antibody testing, and I think that will show. And I think we're going to find that this is more widespread. But you guys got to start opening things up, start giving some hope, some light here. And I think the pools is a really easy fix. And then you can start looking at what the things are doing for beaches. And then the hard task to Commissioner Welch is getting people back to work so that they don't have to worry about where their food's coming from or where their money's coming from. But you got to start somewhere. And I think Kathleen Peters was right. You guys should have done it last week. You missed the boat. Thank you.
Thank you.
Madam Chair, our next speaker is Ken Dulac. Mr. Dulac, if you'll go ahead and spell your name, give us your address, and you'll have 3 minutes to speak. Thank you.
Hi, my name is Ken Dulac, Kendulac. Spoke to you briefly last week. Again, I'm the board president for a very large HOA. It's a high-rise building, about 160 people with one pool. The pool does get crowded. So I've called a board meeting, basically an executive session, to start looking at how do we put in some kind of detail rather than just open the pool to get social distancing that would allow some of our seniors who really need to exercise in the pool an opportunity when other people aren't there because they're the most vulnerable. And we're looking at basically following the county. So we're very dependent on your decisions. We're very dependent on you looking at the data that we don't have and making your decisions based on the best data that you have, because we're going to follow you. If you open the pools, we'll be opening our pool. I know I was told last time, if you want to keep them closed, you can keep them closed. I'll say that if we do that, I'll have probably 100 people on my back saying, you're not doing what the county says you should do. So make your decision based on the best data that you have and the best time, and listening to sheriff as far as people that are starting to no longer tolerate the stay-at-home type rulings. But be aware that we've got to take what you do, just like you take what the governor does, and figure out what does that mean to us, and how many people can swim at what time, and how do we keep people apart in a swimming pool where we've got 160 people and a single pool. So thank you.
Thank you.
Madam Chair, we have 2 more speakers. Our next one is Joan. We only have a first name. Joan, if you could go ahead, unmute, give us your first and last name, spell it, give us your address, and then you'll have 3 minutes. Thank you. Joan.
Hi, my name is Joan Anderson.
Thank you.
Joan Anderson. Anderson. I don't know if you can hear me.
Yes, go ahead.
Okay. I agree with several of the people who've come on and spoke before me. I do want to thank you for your time, and I do thank you for giving us the opportunity to share our thoughts. We will be emailing many of you after today's meeting. I am a registered nurse, and I live in Pinellas County, and I understand to a certain extent what's going on, and probably just as much as many around are on the call today. I do want to just point out, and I think someone else has, that if we're waiting for the data for the % of positive tests, we need to realize that we're only testing people with symptoms. So your expectation, I don't know if that's a valid statistic to be charting for, given the fact that we are only testing people with symptoms. And let's see, I tried to make a bullet list of all my points, but I think I've come to pass some of them. I do want to say, someone pointed out about exercising and pool, and I do empathize with everybody who's out of work. My daughter is out of work. She has no income for her family, her baby. She has no way to pay rent. Scrounging around to make ends meet. And we are exercising. We're exercising the best we can, but I can't walk on the trails because I have arthritis in both knees. So my swimming pool, as sad as it sounds, is really important to me because I pay a lot of money to have a homeowner association with a heated pool, and yeah, I can't use it. So, I mean, that's really, really a big point for me. So that impacts my mobility, and it impacts the mobility of many people in my complex. And I'm going to do the statistics after this meeting to find out just what % of Pinellas County does live in a condo or an HOA and who are above the age of 55. Because I can tell you, we're not congregating at our pool. They're in there, they're exercising for a 2-mile swim each day, and they're not playing. Where they're in there and they're out. They're not, visiting with anybody else that they haven't come to the pool with, that they live with. So, I mean, that's a big difference. But gradually, obviously, we have to do it in incremental steps. And we may have missed that boat if the governor opens it next week and everything's a free-for-all. But I just thank you for your time.
Thank you.
Madam Chair, we have 2 more speakers. We had one other hand go up during that call. Our first speaker is Jennifer. I don't have a last name, so Jennifer, if you give us your first and last name, give us the spelling, your address, and then you'll have 3 minutes. Thank you. Go ahead and unmute, please.
Okay, I'm sorry, Jennifer Harmon, JENNIFERHARMON. My business is in Main Street in Dunedin in Pinellas County. Thank you again for your time and consideration. I've sent a lot of emails, probably driving everybody crazy. I have a small business in Dunedin. We've been closed per your order. We're a pet grooming salon. Before we were forced to close, we did instate policies for curbside service, for dropping off, picking up pets, telephone payments. We had a really good thing going to keep everybody safe. Not only that, the dogs went directly into the bathtub, so we weren't just washing their fur, we're washing our hands too after touching them. Many of us have not seen any disaster funds, and we don't see a lot of hope in getting anything. We haven't even received stimulus checks. So we're struggling. We're really struggling being closed. Being in business for so many years, it would be a sin for us to lose our businesses over this. And granted, I realize we all do want to stay safe. My clients want to stay safe, and so do our staff. But what I'm wondering is if you'll be letting small businesses open in May, if the governor does open the state. We really hope that you consider letting us open, those of us that can adhere to CDC guidelines. We do need to work. We need to provide for our families. We need to pay our rent and our utilities for our businesses and for our homes. Again, we also have clients that are begging us on a daily basis to help them with their pets. Long toenails and hair in their eyes, and dogs just getting a mess, and owners aren't capable of taking care of those things at home. So basically, essentially what I'm asking is if you're going to be considering giving us some hope that you'll be letting small businesses open if the governor does reopen the state May 1st.
Thank you.
Madam Chair, our last speaker is Mr. Neil Volk. Mr. Volk, if you'll go ahead and say and spell your name, give us your address, and you'll have 3 minutes. Thank you.
Hi, Neil Volk. I live at 610 Kentucky Avenue, Crystal Beach. I think most of you on the board know me. I know, Sheriff, we've all had conversations. I take my hat off to Kathleen Peters, starting to step up for the community and the people. I think the pools are essential for those people, as the small businesses are. Bob's got a difficult task trying to enforce the law that I kind of think the county commission and the board kind of stepped over the governor and not following the guidance of a lot of other counties around here. But you guys got a tough task. Dave, I'm glad you're stepping up and trying to support her. I think Kathleen's got a good idea. Let these people get some hope. Let us all get some hope. Let some of these businesses open up that are safe and they're doing it, and stop being so dead on, well, the order doesn't say, but let's do what's general for the rest of the community. All I own car washes. We have a safe, we sanitize cars, we're safe, we're feeding the guidelines. Every other county in the county has it. Other businesses like this dog grooming, I think that's very important. The florist, you guys did a great job when you implemented the safe distance rule. We did it, we enacted it. I have 24 employees that all want to work. I'm keeping some of them on the payroll. They're not getting unemployment. So I'm paying them. I'm trying to help them out. But you all can step up. You can soften up a lot of things before that. Every day is critical. People need something to do. Driving to a car wash and getting their car sanitized is healthy and it helps. Going to the florist and dropping off your loved one as a dog is like a child is important. These are things as a board, as people, that you all can permit. You know, lighten up. The statistics are flattened. I don't think the statistics are all like Jonathan said. He was very eloquent about what he said, but you guys can do certain little things that would help. Take the pressure off Bob. He's getting hammered by businesses. I'm one of them. Okay. We want to go back to work. You want people to go back to work. Give people something to do. The beaches, if that can be controlled, that was Bob's idea. I don't think he wanted to close it in the first place. Y'all are people just like I am. Let's do something now for the people. Give them a little hope. Let those people swim in their pool. They're not going to congregate and hang out with each other because you as a board did the right decision by giving us social distances. And I don't care where you go today, you see it happen. Thank you for your time.
Thank you.
Madam Chair, there are no other speakers that wish to be heard.
Okay. We have one motion on the floor right now to not do anything with the order today, but come back together on Friday. And we have a second from Commissioner Eggers. So we need to take a vote on that. Let me just poll. Does anybody have any comments or questions? Okay. Commissioner Eggers? I'm just gonna poll the board because it's too hard to see.
So in the motion is obviously to come back on Friday for the order.
Right.
I'm an aye on that. Aye.
Okay.
Yes.
Commissioner Justice?
No.
Commissioner Welch?
No.
Commissioner Long?
Well, no. And secondly, if we are going to meet on Friday, can it be in the afternoon since I'm not going to be able to
Well, then why
attend in
should
the
we
AM?
Right. Let's see if we're going to meet on Friday first. Commissioner Seal?
No.
Okay. Commissioner Peters?
Yes.
And I vote no. So that failed 5-2. Yes, Commissioner Welch.
Madam Chair, I'd move the order extending the state of local emergency as presented.
Second.
Okay, we have a motion from Commissioner Welch, second from Commissioner Justice. Anybody have any final words on that one? Okay, all in favor, raise your hand and say aye, please.
Aye.
Aye.
Nay.
Yes. No. Nay.
Okay, motion carries 6-1. Okay. Next issue.
Madam Chair?
Yes. Commissioner Justice.
Thank you, Madam Chair. And as you heard from some of our citizens, I just think it's so important that we continue to communicate that it's not the commission, it's not the county that shut down the groomers, that shut down the floors, that shut down the car washes. Our order of safer at home allowed those businesses to operate if they practices the guidelines. It was a governor's executive order that changed the game and didn't allow those folks to go to work. I just think it's important for us to keep saying that so the folks at home know where we were and where things are. Thank you.
Thank you. And I think our first step down will be back to safer at home. So there is some hope there. Item, where are we, 14?
Item 14 is a change order number 8 to a contract with American Facility Services for janitorial services. This is an expansion of certain areas, the largest being a previous one, which was with the airport. This adds a few other properties to the existing contract.
Move approval.
Question.
Yes, Commissioner Eggers.
Barry, I got an email today that asked, you just characterized it as adding a few more facilities. The email characterized it as changing the scope of the work that the janitorial service is doing now than it was at the very beginning. So just your comment on, are we changing the scope of the contract, or are we just adding a few facilities?
Andrew Pupke is on the line. I'll let him address that directly with you.
Let me see if I can find Andrew. Andrew, if you wouldn't mind raising your hand in the meeting, I'm not seeing you online right now. Oh, there he is. Andrew, go ahead.
Good afternoon, Commissioners. The item before you this afternoon is to add services at certain facilities. The item that you're speaking of is an emergency contract that is separate from this. It's not before the board today for consideration. That was for emergency services related to COVID-19, which is not this item.
So Commissioners, for this contract, we added Public Works Building 9, Sheriff's Operations Warehouse, Loman Exchange. I think what you're referring to is we also implemented as part of COVID-19 additional enhanced cleaning methods in a number of facilities. That's a separate modification that we made as part of our response.
That is correct, yes.
Okay, thank you.
Okay. Do I have a second for that motion? Someone?
Second.
Commissioner Eggers, thank you. Okay, we have a motion and a second. Do we have any further comment?
We do have one member of the public, Madam
I'm
Chair.
sorry.
Mr. Matt Matthews that wishes to speak on this item.
Please.
Mr. Matthews, if you'll go ahead and unmute, give us your first and last name, spelling, and address, and you'll have 3 minutes. Thank you.
How y'all doing? I'm not sure the topic. I was just going to comment on the beaches and pools and reopening stuff. Stop me now if I'm in the wrong forum for this and I was too late for that section.
Go ahead, Madam Chair.
Go ahead, please.
Well, I just wanted to just say, why can't we get, by the way, my name is Matt Matthews. I live in Palm Harbor and work here locally at a golf course. And I was just saying, why can't we, have the vulnerable people, the elderly, people like that stay at home and, go out on your own, out on your own free will, like on your own cause. Just be careful. Also, I just moved here in November and started working in January. And to get unemployment, you have to show 18 months of pay. And my 18 months of pay were in a different state in 2019. So when I worked here, I wasn't eligible. So not only do I not get the unemployment, I don't get the $600. I don't get the stimulus. So I have nothing. Like, you guys got to open it up, or at least try to, for the people that are healthy, that don't have underlying health conditions, that maybe aren't elderly. Let people, it's like signing a waiver. If you think you're healthy and you're fine, go out. We got to try to start opening stuff up, because I have no income at all and I haven't been working. I'm on furlough, and I feel like companies are keeping their employees on furlough so they can they don't have to pay the loan back. Like, get us back to work. I don't, I have no money since the 25th of March. Like, what am I supposed to do? Like the sheriff said, people are going to start freaking out,
Worried about the pools.
So thank you for letting me speak. And sorry I interrupted your topic, and y'all have a great day.
Okay, thank you. Okay, we have a motion and a second. We don't have any more speakers, right?
Oh, ma'am.
Thank you. We have a motion from Commissioner Welch, second from Commissioner Eggers. All in favor, please raise your hand and say aye.
Aye.
Thank you. Motion carries unanimously. Item 15.
This is a Florida Department of Transportation Public Transportation Grant Agreement for the purchase of exit lane anti-pass back technology at St. Pete Clearwater International Airport.
Move approval.
Second.
Thank you. A motion from Commissioner Eggers, second from Commissioner Welch. Do we have any questions, comments? Not all in favor, please say aye and raise your hand. Thank you.
Aye.
Motion carries unanimously. Item 16.
This is a resolution approving the required 5-year update and adoption of the 2020 Pinellas County Local Mitigation Strategy, which is known as the All Hazards Mitigation Plan.
Move approval.
Second with a question.
Yeah, we're using it now, aren't we? Yes, Commissioner Welch.
Well, that was the question. That pandemics aren't mentioned in there unless I missed it. So why does it say all hazards if?
Well,
That isn't
I think
addressed.
it's all physical hazards.
Well,
And Renee is on the line. She's our expert on this, so she could certainly answer that question.
If she could shoot us an email just kind of explaining.
Okay.
Thank you.
We'll have her do that.
Okay.
Okay, we have a motion from Commissioner Long, second from Commissioner Welch. All in favor, please raise your hand and say aye.
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 Okay, opposed? Motion carries 7-0. Item 17.
This is a change order number 1 to a contract with Granite Interliner for storm sewer cured in place piping services. This increase is due to unanticipated work out on Keene and Belcher and 113th Street North that were not included in the original procurement.
Move approval.
Second.
Sorry. Motion from Commissioner Egger, second from Commissioner Welch. We don't have any speakers, do we?
At this time, if anybody wishes to speak, please raise your hand hitting *9 on the phone or hitting the raise hand button in the Zoom application. And Madam Chair, there are no members of the public that wish to speak.
Okay, well, all in favor say aye and raise your hand, please.
Aye.
Motion carries 7-0. Okay, item 18.
This is a purchase agreement with Altos IT Solutions and Services for voice over internet protocol telecommunications equipment. Amount of for a 5-year expenditure of a little over $4 million.
Move approval, Madam Chair.
Second.
Okay.
Madam, at this time, if there are any
Do we have
members of the,
questions? I'm sorry.
if there are any members of the public that wish to speak on this agenda item, please virtually raise your hand hitting *9 or raising your hand in the Zoom application. I'm sorry, Commissioner Peters, go ahead.
Yeah, go ahead.
That's right. I'm curious why the sole source? Why is it specifically stated sole source? I don't understand why we're sole sourcing anything.
Well, it's not really, but I'll let Jeff explain that. Jeff is on the line.
Thank you.
Jeff, go ahead. You should be part of the panel now. Jeff, you there?
Yeah. Yeah, sorry about that. So this is technically a sole source, but it was actually put out to bid on April 17th of 2019, but we received no responses that would meet the requirements except the one vendor. So it looks as if it's sole source, but it actually was competitively bid.
Thank you.
Jeff, not only does it look it, but it actually says it. So that's what brought my attention. So thank you.
Yeah.
Great. Does anybody else have a question? Okay.
Move approval, Madam Chair.
And I think we already had a second from Commissioner Welch.
Yeah.
Okay. All in favor, please raise your hand and say aye.
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 Thank you. Motion carries unanimously. Item 19.
This is the 2020 through 2024 local workforce services plan as submitted by WorkNet Pinellas, i.e. Career Source. There for your approval.
Move approval, Madam Chair.
Second.
We have a motion from Commissioner Long, second from Commissioner Welch. Any comments? Any questions from the?
If there are any comments at this time, please press *9 on the phone or raise your hand virtually. And Madam Chair, there are no members of the public that wish to speak on this item.
Okay, all in favor say aye and raise your hand, please.
Aye.
Aye.
Okay, motion carries 7-0. Thank you. Item 20. Madam Attorney.
Under item 20, I recommend that the board approve staff's recommendation on the proposed settlement as set forth in the confidential memo that I spoke with each one of you about.
Move approval, Madam Chair.
Second, Madam Chair.
You guys are a real team. We have a motion from Commissioner Long, second from Commissioner Welch. All in favor say aye.
Aye.
Opposed? Motion carries 7-0. All right, Madam Attorney, do you have anything else?
I do not, thank you.
Okay, Mr. Burton.
No other report. Obviously, we've discussed what we're working on out of emergency management. The only clarification is that I think there was consensus to move next Thursday's work session to Tuesday.
Which is 9:30, right?
Yes, if that's the concurrence of the board, then I'll move it to next Tuesday at 9:30, the 28th.
Okay. Do we need to vote on that or anything?
I can just schedule it if
It's just the work session, right? Yeah.
well, no, it'll actually, the
Oh,
work
well,
sessions have turned into that because we
Right.
have to vote on
Everything's
the
meeting.
emergency
Yeah.
orders.
Okay. Okay. Do we need to vote on changing that date, Madam Attorney? No?
I have a question.
Yes, Commissioner Eggers.
Are we going to still reserve the possibility of a meeting on Thursday or Friday after we hear from the governor? Or how are you planning that out?
Are you talking this Friday?
No, a week.
Oh.
We're talking about, yeah, I'm sorry, apologize. We're talking about moving we're having a Tuesday meeting now that will be a regular meeting. Are you going to maintain a Thursday or Friday, or are you just going to wait until Monday or Tuesday to make that call?
We can make that call on Tuesday if we have enough information. If you at that time say you need another meeting because we're missing something, we can certainly schedule it at that time.
Okay. All right. Thank you.
Okay, thank you. All right. Item 23 is an appointment to the POC board. We only have one candidate. So if somebody would like to nominate that person.
Move
Yes,
Kyle
Commissioner
Martin.
Rowland.
I move Kyle
Second.
Martin.
Okay, we have a motion from Commissioner Welch, second from Commissioner Eggers. Commissioner Seal, was that a second that you were? Okay. All right, all in favor, say aye.
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 Nay. All right, thank you. Motion carries 7-0. All right, do we have any new business items? Yes, Commissioner
Madam
Peters.
Chair, I have a question.
Oops, I'm sorry, I just called on Commissioner Peters, but I got you.
Go ahead. That's fine.
Yeah, on Thursday, I announced that the childcare centers needed some supplies, and they still are in need of supplies, but I'm happy to announce that Big Storm Brewing was able to get a distilling license, and they are making gallons of hand sanitizer every single day. There's plenty of supply, and they donated 20 gallons to the childcare facilities, 10 gallons to one of our main mental health facilities and drug addiction treatments, and they gave several gallons to PEMS for our Bake Rack facility. So I just wanted to throw out there the community is supporting everybody, and I think it's great. And thanks to Big Storm Brewing, I really appreciate it.
Thank you. Commissioner Long.
Yes, thank you, Madam Chair.
You just muted yourself. Okay.
Barry, on Tuesday, when we meet, will you have by then somewhat of a plan in place to tell us how you plan to shore up the unemployment debacle that we have in our state for the folks that have no money at all and can't buy food or pay rent?
Well, Commissioner, as you know, we do not control the state of Florida's unemployment system.
Right, but I'm talking about the money coming down to us from the feds. Can't we use some of that for that?
Well, yes, we will have a plan for you by Tuesday that'll talk about the stimulus dollars that we are going to pass through to our local residents. So we will have an update and possibly actually a resolution for next Tuesday for you.
Did I hear you say you're not even getting the guidelines until Friday?
That's correct. Our team has put that in place. We've outlined the plan as best we can, forecast where and how we can use these funds. But until we actually see the rules as written by the federal government, we can't finalize that. And so we would like to have that ready for you on Tuesday for action. I mean, we'd like to roll that out tomorrow. But until I get those, it's only a presumption that we can actually, that will be ready by then.
So would that, for the most part, be administered by Human Services?
That is correct. Our intent is to go through an existing program. That's the reason we chose that. They have an existing structure in place, filing requirements. They're looking to staff up to where they can handle the additional requests. And it's an automated process to where we can have accountability on the dollars that are spent also. So that's the reason we chose to go through that system, is so where we can move quickly.
Okay, cool.
Excellent. Thank you so much.
Commissioner Seal.
I hope that we get those guidelines well in advance of Tuesday so we have time to take a look at them. I know you're going to be working really hard on it. But I hope that we can prioritize the people who have not received income first. I don't know how we do that, but we are really the basket for them and the place where they have nothing coming in, and we really need to help those who have not been able to get unemployment or PPP from the feds. I think those families that are in desperate need and businesses are where we need to go. Also, I just want to take this time to also thank everyone, our staff, as well as all of the EMS personnel, the healthcare workers, all those who are responding with their heart and soul and their lives every day, and helping us to come out of this in a better place. And but then finally, I also would like to, on Tuesday, to have a better report on the nursing homes and the assisted living facilities. And I understand that ACA's involved, and I understand that there's other players, but I'd like to know that I'd like to have a better report. So I'd appreciate that.
So Barry, going along with what Commissioner Seal said, when you get those guidelines, could you send them out to us?
Absolutely.
Assuming they're not 400 pages, in which case we'll just take
it's a federal report, so I would anticipate
yeah, I know.
that, but we certainly can make them available.
Okay, thanks. Commissioner Eggers?
Yeah, thank you, Commissioner Seal. I agree with your comments. I think those are spot on. Also, just wanted to say that we did have a Tampa Bay Water meeting yesterday, and we actually, it was our first board meeting under the current scenario, and it really turned out pretty good. There was obviously some bumps in the road, but it turned out pretty well. I just want you to know that at this point, the budget was scrutinized. They'll be coming back in June for approval of that budget. I think that will go okay. There's a lot of questions that were asked, and so they'll be coming with some answers there. But at the end of the day, the wholesale rate to us as users will be the same to Pinellas County and all the other users. And I just really want to say that they're in close contact with our utility people. So our utility people know the story at Tampa Bay Water, and it's a good one. There's plenty of water. There's a high demand for it. Swift Mud and Tampa Bay Water will be working carefully to get the word out to our residents and all residents within the region to please watch what you are consuming right now. We're still in that dry phase, and we don't want to over consume the water that we have, but everything is good. And I just wanted to pass that along. And then finally, I just would ask our residents, I know we're going through such tough times, and some tougher than others. And I wouldn't even pretend to understand and feel what some of the folks are going through. But just please do what you can to respect our police officers, our frontline sheriff deputies. And, there's a lot of federal orders that have come down, state orders and county orders. And those are the messages that you can take exception with, but please try to have that respect for our police officers. They're simply implementing what we have asked them to do. I just ask you to maintain that patience just a little bit longer. Hope is around the corner, hopefully. Thank you.
Great message. Thank you. Yes, Commissioner Long.
Thank you, Madam Chair. I wanted to let you all know it's very exciting that in our meetings last Friday with T-BARDA, we learned that they had received $2.2 million from the feds under the CARE Act. And PSTA will be receiving 40 million for their share under the CARES Act. And that was very welcome news for both of those agencies and helps out a lot, especially now. So that's the end of my report for today. We have a TBARTA meeting on a Friday and a PSTA board meeting on Wednesday. Thank you, Madam Chair.
All right. Anybody else? Yes, Commissioner Welch.
Just want to echo Commissioner Seal's kudos to all the partners. And I wanted to thank you, Madam Chair, for all of your great work on this. You've had like an extended hurricane season. So thank you for all you're doing.
That hasn't even started yet.
It hasn't. I just thought I'd bring it up.
Thanks.
But I want to ask Barry, are we monitoring the reopen Florida task force?
Yes.
Is Brian going to be able to give us like a daily summary or?
Well, there's actually 2 task force meetings this afternoon.
Okay.
And so they're meeting daily, and they divided up into 3 committees. I was on the call yesterday and I listened in. And so they divided up into 3 task forces. They're going to be then, so we could try to summarize those. I think we'd have it, that would be a lot of hours to listen to all that.
No,
but it will come out on Friday. So
yeah. I don't want to add more work. I'm curious, with only 3 days, it seems like the roadmap would really have to be already set.
Well, and that's what I'm trying to find. I would love to find out, and Sheriff and I have talked about this. I mean, when you're bringing a lot of very seasoned folks together, I would hope that they have options and ideas to bounce around, and use their time wisely. And so that's why I'm hopeful that coming out of this, we would soon get a picture in terms of where the state is going regarding that order. Because I think they know they're going to operate within a box, and they've got some choices within those boxes. So hopefully it would be timely, and we should have guidance coming up by this weekend or very, very early next week.
And I'm sure Southern is monitoring this as well.
I'm sure they are. I haven't talked to Laura about it, but I'm sure they are.
Okay. Thank you.
Hey, anything else for the good of the, yes, Commissioner Peters. Sorry.
Thank you, Madam Chair. We got word last night for any citizen that's having trouble with unemployment, if you go to myfloridahouse.gov and reach out to your legislator, either the Senate or in the House, if you call them or reach out to them, they will file a form to the Department of Economic Opportunity for you to help expedite it. So for all of your staff, let them know if anyone calls for help. But for the people that are watching the meeting, if you are having trouble with your unemployment processing, just go to myfloridahouse.gov and reach out to your state representative, and they will file the forms for you and help expedite it. Thank you.
Well, and again, if you haven't gotten an application in yet, please contact CareerSource and have them help you do a paper application and bypass the computer system. So anything else? All right, we are adjourned until Tuesday at 9:30, right?
All right.
All right.